health matters now, and humanitarian medical NGO Doctors Without Borders has launched an appeal to raise funds to fight an Ebola outbreak in the Democratic Republic of Congo. At least 25 people have died so far in Bikoro in the country's east. 35 cases have also been confirmed. Let's speak to Doctors Without Borders spokesperson, Dr. Stefan Kruger. Thank you so much for coming through, Dr. Kruger. So, in the last 2 weeks, we saw you were concerned as, healthcare workers and aid workers about the possibility of this Ebola outbreak perhaps making its way from the rural parts of eastern DRC to urban centers. Is that concern growing by the day, or have you been able to make interventions, various interventions that perhaps can help arrest this outbreak?
You did right. Of course, it is still a concern. We've known for a couple of days now about cases in Mbandaka, which is a larger city a little bit north of Bikoro. And, it's a port city with good transport networks and also access along the rivers. But it seems so far that in that centre, the containment of it has been fairly effective from what we hear and what we see. But it is a massive undertaking. This is a city with about 1 million inhabitants. So you can imagine how difficult it is getting infection control policies in place.
In terms of the evolution of the current outbreak, how is it looking? Does it look, of course, Ebola outbreaks, you would know better than I do, that, are not something that's new in the DRC. I mean, the virus is named after a river in the Congo. How is it looking in terms of, the evolution thereof and containment?
Yeah, that's true. This is the 9th time that there's an outbreak in the DRC. This one is already different to the typical outbreak in the DRC in that it's not only in rural areas and that it's in more than one location, and those are areas of concern. Having said that, there are also positive signs that we have seen. So far, 25 deaths. Of course, that's 25 too many, but compared to the numbers we saw in West Africa, it's definitely at a point now where we can stop it. Now is a critical time, and if we work fast, we can see good results.
There is no cure, of course, but there was a vaccine that was in the trial phases that was going to be tested, in the DRC. Has that progress, has that started happening? Because I remember having this conversation about 2 weeks ago, I think with Doctors Without Borders as well. Has that started happening, and, is it helping?
It has started. Now, this is of course, a very good development, and at the moment it's still a trial drug. It's not officially registered for use as a vaccine against Ebola, but the way that it's being implemented is through a so-called ring vaccination campaign. So if a patient is confirmed as having Ebola, then everybody who came into contact with that patient will be offered the vaccine, and if they choose, then they will be vaccinated. And also, and this is particularly where MSF is more involved, is offering the vaccine to frontline healthcare workers because they are at particular risk.
Dr. Kruger, that area of the eastern DRC is a particularly difficult area in terms of, the political situation, the volatility, and the outbreak of violence from time to time, and, general instability. What does that do? How does that come in as a factor in the equation of responding to such an outbreak? For instance, under what conditions are your workers finding themselves in that particular area? And does that, sort of discourage other aid organizations from deploying in an area like that? Unfortunately, I haven't been able to get to the field myself yet. But from what we understand, DRC, like you say, is notoriously difficult to work in. At MSF, we were at a slight advantage in the sense that we already had projects set up throughout the country. We already had a reasonable amount of supplies on standby in Kinshasa. So when Ebola struck, we were in a good position to act fast. Of course, we're trying to scale up our response, and at this point, more is needed. We do have, I think, a considerable staff complement with a lot of experience working specifically in DRC, and that definitely does help us. So just finally, talk to me about lessons that were learned from the very deadly West Africa outbreak of the last 2 years or so. How are you implementing those lessons on the ground at the moment in the Eastern DRC, and also perhaps the communities there? Are you able to give them better education, and do they grasp some of the preventative measures that need to be in place to avoid the spread of the disease?
I think the communities in DRC are perhaps a bit better sensitized to any health promotion surrounding Ebola, because they've been exposed to it before and because they know the effects of it. So that part of it does help us. I think the biggest lesson learned from the West African epidemic is just the speed at which you need to move. Every day that you waste is another day that actually every day that you waste is another 5 days that you need to catch up later on. So that is critically important, and that's really something that we're working on at the moment. It's also very important that there must be from the start a very good, strong will from all stakeholders involved. That includes the World Health Organization, the Ministry of Health, and all other NGOs that are involved. And so far, what we've seen in the DRC is a better approach to what we had in West Africa.